Good afternoon. I'm Laurence Gardner, the Executive Dean for Education and Health Policy here at the Miller School. And I've been given the opportunity to talk a bit with you about advances and changes in the educational program as we move into the new calendar year and then subsequently the new academic year. So let me break it into two parts. The first has been the continuing challenge of the graduate medical education programs, both in Miami-Dade County and at our regional campus in Palm Beach and Broward County. Let me mention the latter first. We're exceptionally proud of the accreditation of the programs at the JFK Medical Center, which was accomplished without a single citation and with a commendation to the medical faculty and leadership of those programs. And the surgical program and the program in internal medicine continue to do well and attract progressively more competitive applicants. We're working with other hospitals in the Broward County area, in particular Holy Cross Medical Center, regarding the development of additional graduate medical education programs and a more significant affiliation with Holy Cross at the institutional level, which is proceeding along without much difficulty. So we're optimistic that that's going to take place. We'll have some progress to announce in 2013. On the Miami campus, resolution of some challenging issues around transplant and trauma, along with a remarkable collaborative and collegial agreement in cardiology, has continued to strengthen our graduate medical education programs, which we share with Jackson. Now, in undergraduate education, where you might think we don't have any issues or difficulties, we want to change the entire system. We'd like to turn it on its head. But we recognize that we need to do this in partnership with the students and the faculty and the other stakeholders, and incrementally as opposed to instantaneously. Our goals for undergraduate medical education are continue to improve the excellent program we already have with regard to content, teachers, and students, but change the delivery and assessment system to reflect more modern educational principles, especially those recently espoused by Salman Khan in his videos and book. We're looking to make our learners, students, more responsible for the acquisition of knowledge, and our faculty more responsible for testing the mastery that our students have of that knowledge. We're looking to use online resources to teach facts and at-school resources to teach problem-solving, retention, and importance. We'd like to change our system from a chronologically based system to a competency-based system. So you finish a course when you master it, not when the calendar says you do. The challenges here obviously are small things like the university calendar, the training program calendar, the medical school calendar, the licensing exam calendar. But these are the sorts of challenges that should appeal to educators and do. And with bright students and remarkably committed faculty, we think we can make this all work. The outcome, we expect, will be a better trained, better prepared medical student who will finish his or her curriculum in a time appropriate to each individual, in many instances allowing them either to finish early and proceed to the next stage of their training, or to acquire a second degree, or to acquire additional competence in an area of their choice. All of this is in keeping with an imperative sweeping education throughout the United States, and that is to shorten the time as much as possible to the acquisition of degrees and the time from school to implementation of a career. Most of us who are teachers and educators entered this area voluntarily because, frankly, it provides for us personal and professional satisfaction of a degree unequaled by almost anything else we could do. We are sitting in the United States at a remarkable time when recent legislation and decisions by the entire electorate have made the statement that we should provide health care to all of our people. And in order to do that, we need to increase the workforce and the way the workforce delivers health care. We need to think dramatically about differences in health care delivery, and we need to train our physicians to be nimble and to respond to changes in the environment. Not only do they need to treat individual patients, but they need to think about how we can most effectively and appropriately deliver care to different populations in different settings under the constrained resources that anybody has to deal with, and do it well and show great outcomes. So all of these challenges are, in no small measure, part of the reason behind the changes in curriculum I just had a chance to chat with you about. We expect to prepare learners capable of acquiring new information, adapting to changing environments, and to making a difference. Almost any of us who have had anything to do with schools of medicine recognize we have a unique opportunity to raise the quality of health care in our community, to really make a difference to the patients and the people who would like to remain well, and to be part of this new wave of change which will take us from the model of sickness to the model of wellness as we move forward.